Welcome to the Deep Dive. Today, we're going to be diving into the world of geriatric care.
Oh, that's fascinating.
We've got a chapter from a medical textbook on
Right.
geriatrics
Huh.
and 2 case studies.
Okay.
And I think it's going to be really interesting to kind of see how these
Yeah.
things work together.
Yeah.
So much of what we talk about on this show is
Huh.
like, high-level stuff.
Yeah.
But when you get down to the nitty-gritty of like,
Right.
what healthcare providers are actually dealing
Yeah.
with patients, it gets really interesting.
Absolutely. I think, what's really interesting about geriatric care is how aging can be so individual.
Yeah.
What might seem like a straightforward issue in a younger person can become like a multi-layered puzzle in an older adult.
That's such a good point.
Yeah.
The textbook actually starts with a line, "The gradual progression of age is a complicated process."
Right.
It's like they knew we were going to be doing a deep dive on this.
Yeah.
And then goes on to talk about how aging itself can actually obscure underlying health problems.
Absolutely.
And then on top of that, medications can have this like ripple effect on symptoms.
Right. Right. And that's why, in geriatric care, you can't just treat the most obvious symptom.
Right.
You have to really look at the whole picture. It's kind of like detective work, piecing together all these different factors to get to the root of the problem.
Okay, I'm already hooked. Let's get to the case studies.
Okay.
So the first one is called Clarence.
Okay.
And it paints a really vivid picture. Imagine you're called to help an elderly man who collapsed
Yeah.
while making lunch on a freezing winter day.
Okay.
So you get there,
Yeah.
and Clarence is conscious but weak, a little disoriented.
Often it's these everyday activities that become incredibly risky for older adults. Their bodies just don't have the same reserves they used to.
That's so true.
Just a simple task like making lunch can become dangerous.
And in his
Sure.
case, he's got a pretty packed medical history. He's on nitroglycerin, digoxin, hydrochlorothiazide, a whole bunch of medications.
Wow.
And it turns out that his collapse was probably due to a sudden drop in blood pressure,
Okay.
likely caused by a combination of those medications.
It's a classic example of what we call polypharmacy. When a patient is on multiple medications,
Right.
incredibly common in older adults.
Yeah.
But as Clarence's case shows, it can have some really serious consequences.
This polypharmacy thing sounds like a huge deal.
It is.
And the textbook doesn't really hold back on the potential dangers either. It mentions drug interactions,
Right.
unexpected side effects,
Mm-hmm.
and just the sheer difficulty some patients have keeping track of all those pills and dosages.
You might be surprised to learn that even over-the-counter medications can contribute to dangerous interactions in
Yeah.
older adults. It's not just prescription drugs we need to be aware of.
Wow, I hadn't even considered that.
Yeah.
So regular medication reviews are really crucial for these patients.
Oh, absolutely. It's about finding that balance.
Yeah.
Effectively managing their conditions while also minimizing the risks. Sometimes simplifying that medication regimen can make a world of difference.
Yeah, that makes a lot of sense.
Yeah.
Okay, on to case study number 2, the confused woman.
Okay.
This one takes us to a busy shopping mall
Uh-huh.
where an elderly woman is walking in and out of traffic, clearly disoriented.
Oh, wow.
Her blood pressure is high, pulse is racing, but there's no information about her medical history.
So this scenario immediately makes you think about potential cognitive impairment. But
Right.
without that medical history, it's like navigating a maze in the dark.
Right.
You have to be extra cautious.
You're working with limited information.
Right.
So what could be happening here? The case study mentions dementia, delirium,
Yeah.
or even medication-related issues as possibilities.
All on the table, and it's important to tease them apart. Dementia, as the textbook explains, is this long-term progressive decline in cognitive function.
Right.
It's not a normal part of aging.
Right, and it's interesting because they make a distinction between dementia and delirium.
Right.
So dementia is this long-term,
Yeah.
gradual decline.
Right.
But delirium, that's different, right?
Exactly. Delirium comes on quickly,
Okay.
often within hours or days, and it can fluctuate.
Yeah.
It's usually triggered by something specific like an infection, medication side effect, or even just a change in environment. And the good news is
Okay.
it's often reversible if you can pinpoint and address that underlying cause.
I see. So both of these cases really highlight the importance of being super observant,
Absolutely.
especially with those like subtle signs of cognitive impairment,
Yeah.
whether it's dementia or delirium.
A thorough assessment is crucial in geriatric care, considering everything from their medical history and medications
Yeah.
to any recent changes in behavior or environment. It's like putting together a jigsaw puzzle.
Before we jump into the specifics of dementia and delirium, the textbook also talks about how aging impacts the body in general.
Yeah.
I think it'd be helpful to touch on that first.
Yeah, good idea. The textbook explains how aging affects pretty much every system in the body,
Right.
from the cardiovascular system to the way our brains function.
So it's not just about wrinkles and gray hair.
No, these are fundamental changes happening beneath the surface.
Yeah.
For instance, our blood vessels become less elastic as we get older,
Right.
which contributes to higher blood pressure.
Yeah.
And our brains naturally change over time, sometimes leading to memory problems or difficulty with thinking clearly.
The textbook also emphasizes that medications can affect older adults differently than younger people.
Oh, that's a really important point to remember.
Yeah.
Our bodies process medications differently as we age.
Yeah.
Our organs might not be as efficient at breaking down and eliminating those drugs,
Right.
which can increase the risk of side effects, even with common medications.
Wow. So it's this delicate balance, between managing their conditions and then also being mindful of how their bodies are processing these medications.
And that's why starting with lower doses and carefully monitoring for any reactions is so important in geriatric care. It's not a one-size-fits-all approach.
This makes me think about how crucial communication is in geriatric care.
Yes.
If a patient is experiencing confusion
Yeah.
or disorientation,
Yeah.
they might not be able to clearly explain
Right.
their symptoms.
Absolutely. It's about building rapport and trust.
Yeah.
So patients feel comfortable sharing what they're experiencing,
Yeah.
even if they can't articulate it perfectly.
Right.
Sometimes observing their behavior and nonverbal cues
Yeah.
can be just as important as what they're able to tell you directly.
It's like you're putting together this puzzle
Yeah.
using every piece of information you can gather.
And that brings us back to those two conditions we were discussing, dementia and delirium.
Right.
These are two diagnoses that often come up in geriatric care.
And it's so important to understand how they differ.
Okay, so let's dive into those definitions from the textbook. It says, dementia is a chronic and progressive decline in cognitive function
Yes.
that interferes with daily life.
Right. And delirium is defined as a sudden disturbance in mental abilities
Well,
that results in confused thinking and reduced awareness of the environment.
so dementia is this gradual decline,
Right.
while delirium is more like a sudden shift
Exactly.
in mental state.
If we can figure out what's causing it
Right.
and address that underlying issue.
And the textbook also digs into the potential causes of each condition. It says the most common cause of dementia is Alzheimer's disease.
Right.
But there are other types,
Mm-hmm.
like vascular dementia, which happens when there's damage to the blood vessels in the brain.
And with delirium, the triggers can be incredibly diverse. Infections, medication side effects, dehydration, even changes in surroundings can all bring it on.
So it sounds like early recognition is key for both dementia and delirium.
Absolutely.
The sooner you catch it,
Yes.
the better the chances of managing it effectively.
Early detection and intervention can make a huge difference.
Okay, let's do a quick recap.
Mm.
We've talked about the complexities of geriatric care,
Uh-huh.
the importance of a thorough assessment,
Yeah.
and the potential dangers of polypharmacy.
We've also touched on the challenges of communication.
Right.
And the need to be sensitive to the unique needs of older adults.
Yeah.
It's about seeing them as individuals, not just a collection of symptoms.
Before we wrap up this part of our deep dive,
Yeah.
I'd like to revisit those two case studies
Okay.
and kind of apply what we've learned about dementia and delirium.
Sounds good.
So let's start with Clarence,
Okay.
the man who collapsed while making lunch. He was on multiple medications,
Yes.
experiencing hypotension.
His case is a perfect example of how polypharmacy can create this cascade of issues, you know?
Yeah.
Those medications might have interacted in a way that caused his blood pressure to drop,
Right.
which in turn could have triggered delirium.
But it's not just the direct effect of the drugs themselves.
Right.
It's how they work together
Yeah.
within his aging body.
It highlights the need for constant vigilance when prescribing medications for older adults, taking into account those potential interactions and side effects.
Now, with the confused woman
Yeah.
who was wandering in the mall,
Yeah.
Her case seems to fit the classic picture of delirium,
It's
right?
just a strong possibility. But remember, we don't have her full medical history.
Right.
It's possible she was experiencing an episode of delirium on top of underlying dementia.
Right.
We simply don't have all the pieces of the puzzle.
Which emphasizes how crucial
Yes.
a comprehensive assessment is.
Absolutely. We need as much information as possible to determine the most likely cause of those symptoms and come up with an effective plan of care.
And that assessment should include everything from their medication history
Right.
to their behavior and environment.
Exactly. You have to look at the big picture,
Yeah.
not just the isolated incident.
Well, that brings us to the end of part 1 of our deep dive into geriatrics and polypharmacy.
Okay.
We've covered a lot of ground,
Yeah.
but there's still much more to explore.
Looking forward to it.
In the next part, we'll delve into strategies for managing polypharmacy,
Okay.
including medication reconciliation
Yes.
and the concept of deprescribing. It's a fascinating area with a lot of potential
Yeah,
to improve patient care.
I'm sure.
Stay tuned. This journey into the world of geriatric care is just beginning.
All right. Welcome back to our deep dive into geriatrics and polypharmacy.
I'm ready for more.
Before we get to those management strategies,
Great.
I think it's worth revisiting a point we made earlier.
Okay.
The way medications can interact in older adults is truly fascinating.
You mean that synergistic effect
Yeah.
where multiple medications can create a much bigger impact than any single drug would on its own?
That's it.
Yeah.
As we age, our bodies become more sensitive to medications,
Right.
and those interactions can become incredibly complex.
Wow.
It's like a domino effect, where one change triggers another,
I see.
which makes diagnosis and treatment that much more challenging.
So it's not just about the sheer number of medications.
Right.
It's about how they work together
Exactly.
and how they impact the aging body as a whole.
The whole picture.
Yeah. There's a lot to keep track of.
It really is.
Wow.
Imagine a patient taking a diuretic for high blood pressure
Okay.
and also an antihistamine for allergies.
Uh-huh.
Individually, these drugs might be fine,
All right.
but together they can significantly increase the risk of dizziness and falls,
Oh, wow.
especially in someone who's already a bit unsteady on their feet.
That's a great example.
Yeah.
It really shows how those seemingly harmless medications
Right.
can have these unexpected consequences when combined.
Absolutely.
It's a reminder that we need to be extremely careful
We do.
when prescribing medications for older adults,
Yeah.
considering not only the intended effects,
Right.
but also those potential interactions and side effects.
You got it.
So how do we manage polypharmacy effectively? Is there like a secret?
It's a multifaceted approach.
Okay, so walk us through it.
Sure.
What are the key strategies?
Well, the first step is what we call medication reconciliation.
Okay,
Essentially, it's a thorough review of all the medications a patient is taking.
got it.
Not just prescription drugs, but over-the-counter medications and even herbal supplements.
Is that everything?
We need the full picture.
Like taking inventory.
Exactly.
Everything that's going into their system.
And during this process,
Yeah.
we're looking for any red flags,
Okay.
potential drug interactions, duplications, or medications that might not be necessary anymore.
It seems like this would involve a lot of communication.
It does.
Not just with the patient,
Right.
but with their family as well.
Absolutely. It's essential to get everyone on the same page,
Yeah.
gathering information about their medication history, any allergies or past reactions they've had,
Right.
and even their understanding of why they're taking each medication.
So it's a real team effort.
It is. It's a
Yeah.
collaborative effort.
It's not just about checking off boxes.
Yeah.
It's about having these
Right.
meaningful conversations to ensure the patient is informed and involved in their care.
Exactly.
And once we have a clear understanding of their current medication regimen,
Right.
we can move on to the next step,
Yeah.
deprescribing.
Deprescribing.
That sounds a bit counterintuitive.
I know, right?
Yeah.
But it's essentially the process of carefully and thoughtfully reducing or stopping medications that might not be doing any good or
Right.
might even be causing harm.
So it's about finding that balance again,
It is.
making sure they're getting the benefits without unnecessary risk.
You got it.
Yeah.
And deprescribing is a delicate process.
Right.
It requires careful consideration of their individual situation,
Of course.
their medical history, the potential risks and benefits of each medication. It's not a decision to be made lightly.
I imagine it also takes patience,
It does.
both from the healthcare provider and the patient.
Absolutely. It's not always a quick fix.
Right.
It might involve gradually tapering down doses,
Okay.
monitoring for any changes in symptoms,
Mm-hmm.
and adjusting the plan as needed.
Yeah.
It's an ongoing process.
It sounds like it's all about working together,
It is.
finding the best approach for their individual needs.
That's exactly right. The goal is to optimize their medication therapy
Yeah.
to improve their quality of life while minimizing potential harm.
So we've talked about medication reconciliation and deprescribing.
Right.
What other strategies do you use to manage polypharmacy?
Well, one important aspect is simplifying the medication regimen as much as possible.
Okay.
This might involve using combination pills instead of multiple separate medications,
Right.
choosing medications that can be taken once a day instead of multiple times,
Yeah.
and providing clear, easy-to-understand instructions.
Yeah.
Anything that makes it easier for the patient to manage.
It's about setting them up for success.
Exactly.
Yeah, making it as straightforward as possible
Right.
for them to adhere to their medication schedule.
Exactly. And speaking of adherence,
Yeah.
we also need to address any barriers that might be preventing them from taking their medications as prescribed.
What kind of barriers are we talking about?
Oh, it could be anything.
Okay.
From difficulty opening pill bottles
Right.
to cognitive impairment that makes it hard to remember doses,
Mm-hmm.
even financial constraints if they're struggling to afford their prescriptions.
Right.
We need to take all of this into account.
It sounds like it's about being proactive,
It is.
asking the right questions
Yeah,
to understand the challenges they might be facing.
absolutely. And then working with the patient and their family to find solutions,
Mm-hmm.
whether that's using pill organizers, providing reminders, or connecting them with resources to help cover the cost of medications.
It's about meeting them where they are.
It is.
Yeah, it really highlights how important
Yeah,
a holistic approach is in geriatric care.
that's a great point.
Yeah.
We can't just focus on the medical aspects. We
Right.
need to consider the whole person,
The whole person.
their physical, mental, and social well-being.
It's about recognizing that their needs are often complex
They are.
and that it takes a team effort to provide the best possible care.
Exactly.
And that team can include
Oh, it can include physicians, nurses, pharmacists, social workers, physical therapists,
wow,
even family members.
everyone's involved.
Everyone plays a role.
It circles back to that need for empathy and patience that we talked about earlier.
Yes,
It's about approaching geriatric care with a deep understanding
it
of the
is.
unique challenges older adults face.
Couldn't agree more.
Yeah.
And it's about building those strong relationships with our patients. Relationships built on trust, respect, and open communication.
Okay, so we've covered a lot of ground on polypharmacy.
Ye have.
Now, I'd love to revisit Clarence and the confused woman from our case studies
Okay,
and see how these concepts play out in their situations.
let's do it.
So Clarence was on a cocktail of medications,
was.
including nitroglycerin, digoxin, and hydrochlorothiazide.
Right.
His case was a classic example of how polypharmacy can lead to adverse events like hypotension.
Absolutely. And it underscores the importance of regularly reviewing the medications of older adults,
Right.
considering those potential interactions and side effects.
Hmm.
Something as simple as a medication review could have made a huge difference in his case.
So with Clarence,
Yeah.
a medication reconciliation and deprescribing process might have helped identify any problematic medications
It might have.
and potentially reduce his overall medication burden.
Exactly. It's possible that some of his medications could have been safely discontinued
Okay.
or the dosages adjusted to lower the risk of hypotension. It's about fine-tuning the regimen to meet his individual needs.
And what about the confused woman?
Yeah.
How did these discussions about polypharmacy and cognitive impairment apply to her situation?
Well, we don't have her medication history,
Yep.
so we can't definitively say whether polypharmacy was a factor in her disorientation and confusion.
But it's certainly a possibility,
It is.
especially given that medications can sometimes trigger delirium in older adults.
It's definitely something to consider,
Yeah.
especially when you're dealing with an older patient who is presenting with cognitive impairment. It
Right.
should always be on your radar.
So even though we don't have the complete picture with her,
Right.
it serves as a reminder that polypharmacy is a prevalent issue in geriatric care,
It is.
and it can have a significant impact on cognitive function.
Absolutely.
Yeah.
It really highlights the need for careful medication management in this population. It's about finding that balance between managing their conditions and minimizing potential harm.
Okay, let's shift gears a bit and delve into the textbook's discussion of dementia and delirium.
Okay.
I think it would be helpful to unpack those definitions in more detail.
Sounds good.
So the textbook defines dementia as a chronic and progressive decline in cognitive function that interferes with daily life.
Right.
It emphasizes that dementia isn't a normal part of aging,
No, it's not.
and it's caused by a variety of factors, the most common being Alzheimer's disease.
Right?
So it's a gradual decline in cognitive abilities
Yes.
that eventually impacts a person's ability to function independently.
That's right. And the symptoms of dementia can vary widely
Okay.
depending on the underlying cause and the stage of the disease.
What are some of the most common symptoms?
Well,
What should we be looking out for?
in the early stages,
Yeah.
people with dementia might experience memory problems,
No.
difficulty finding words,
Mm-hmm.
and changes in mood or personality.
It's interesting.
It's often subtle at first.
And as the disease progresses,
Yeah.
those symptoms become more pronounced.
Exactly. They might have trouble with tasks they used to do easily,
Okay.
like cooking or managing their finances.
Right.
They might get lost in familiar places or
Sure.
have difficulty following conversations.
It's heartbreaking.
It is.
This disease takes such a toll on both the individual and their family.
It does. And while there's no cure for dementia,
Right.
there are medications and therapies that can help manage the symptoms and improve quality of life.
Okay.
Even small improvements can make a big difference.
Okay, now let's talk about delirium.
Sure.
The textbook defines it as a sudden disturbance in mental abilities that results in confused thinking and reduced awareness of the environment.
Right.
So delirium is characterized by its rapid onset
Yes.
and fluctuating course.
Exactly.
Symptoms can come and go throughout the day,
You can.
and the person might seem disoriented and confused one moment
Right.
and then completely lucid the next.
Exactly.
That sounds incredibly frightening,
It can be.
both for the person experiencing it
Yeah.
and for those around them.
People with delirium might have trouble focusing their attention. They might hallucinate,
Wow.
and they might become agitated or restless.
So how is delirium different from dementia?
Okay.
What are the key distinctions?
The main difference is that delirium is usually temporary and reversible,
Okay.
whereas dementia is a progressive and irreversible condition.
But I imagine the symptoms can overlap,
They can.
which could make it difficult to tell them apart.
We're right.
Yeah.
The symptoms can be similar. However, there are a few clues that can help us differentiate between the two.
For example, that sudden onset and fluctuating course of symptoms
Yes.
is more characteristic of delirium.
Exactly. And while dementia typically develops gradually over months or years,
Right.
delirium can come on within hours or days.
Wow. Yeah.
It's much more rapid.
The textbook also mentions that delirium is often triggered by an underlying medical condition or by certain medications.
Absolutely.
So infections, dehydration, electrolyte imbalances,
Yeah.
and medication side effects.
Right.
These are some of the most common culprits.
They are.
So if you can identify and treat the underlying cause, delirium should clear up.
Precisely.
That's why it's so important to conduct a thorough medical evaluation
It is.
when an older adult presents with cognitive impairment.
Yes.
You have to rule out any potential medical causes.
Yeah, absolutely.
Okay, let's bring this back to our case studies.
Sure.
Do you think Clarence could have been experiencing delirium
It's possible.
in addition to the hypotension?
It's definitely possible.
Yeah.
His disorientation and weakness could have been symptoms of delirium
Right.
triggered by his medications or even by the hypotension itself.
Yeah.
It's hard to say for sure without more information.
And the confused woman,
Yes,
her case seems like a textbook example of delirium.
it does.
The sudden confusion,
Yeah.
disorientation, and
Uh.
wandering behavior, it all fits.
It's a reasonable assumption, but again,
Yeah.
without knowing her medical history,
Right.
we can't rule out the possibility of underlying dementia.
Right.
She could have been experiencing an episode of delirium on top of a pre-existing condition.
Both cases really illustrate how complex can be
They do.
to diagnose and manage cognitive impairment in older adults.
Yes.
It's not always clear-cut.
That's why it's so important to be thorough in our assessments, to consider all the possible causes,
Right.
and to work closely with patients and their families to provide the best possible care.
Well, we've covered a lot of ground in this deep dive.
We have.
We've explored the challenges of polypharmacy and the importance of recognizing and managing cognitive impairment.
Absolutely.
We've also discussed the need for a holistic and empathetic approach to geriatric care.
Yes.
It's about seeing the whole person,
It is.
not just their age or their medical chart.
Couldn't agree more.
Before we wrap up this part, I want to go back to the textbook's discussion of the aging process itself.
Sure.
It emphasized how aging impacts every system in the body,
It does.
making older adults more vulnerable to a wide range of medical conditions.
That's such a crucial point. As
Yeah.
healthcare providers,
Yeah.
we need to have a deep understanding of these age-related changes
Right.
and how they can impact our approach to diagnosis and treatment.
For example, the textbook talked about how the cardiovascular system changes with age,
Yes.
leading to decreased cardiac output and increased blood pressure.
Right, and it also highlighted the changes in the respiratory system that make older adults more susceptible to pneumonia and other infections.
Wow.
Their immune systems just aren't as robust as they used to be.
It also discussed how aging affects the musculoskeletal system,
It does.
leading to decreased bone density and muscle mass, which increases the risk of falls and fractures.
Right.
Those everyday activities can become much more dangerous.
Absolutely, and we can't forget the changes in the genitourinary system,
Right.
which can lead to urinary incontinence and other issues.
It's really about recognizing that aging affects the entire body.
It does.
Yeah.
It's a whole body process.
All of these changes emphasize the need for a comprehensive geriatric assessment.
Yes, they do.
One that takes into account the individual's overall health,
Right.
their functional abilities, and their social support system.
Exactly. We need to look beyond the presenting problem
Right?
and consider the whole person,
The whole person.
recognizing that older adults often have multiple coexisting medical conditions.
And we need to be mindful of the potential for atypical presentations of illness in older adults.
Absolutely.
Yeah.
What might look like a classic heart attack in a younger person
Right.
could manifest as confusion or weakness in an older adult.
Oh,
Their bodies just don't always respond in the same way.
So it's about being aware of those subtle signs and symptoms
It is.
and being proactive in our approach to care.
Exactly. And that includes being vigilant about polypharmacy
Right.
and its potential impact on older adults. It's a thread that runs through so much of geriatric care.
Okay. I think we've covered a lot of important ground,
We have.
but there's one more crucial concept from the textbook that I want to touch on.
Okay.
The ethical considerations in geriatric care.
Uh-huh.
I feel like this is something that often gets overlooked.
It's incredibly important.
Yeah.
The textbook stresses the importance of respecting the autonomy and dignity of older adults and making sure they have a say in their care decisions.
So that means having open and honest conversations with them about their treatment options
Yes, it does.
and ensuring they understand the risks and benefits of each choice.
Right.
It's about empowering them to make informed decisions.
Exactly. And it also means being sensitive to their cultural beliefs and values.
Yeah.
And respecting their right to make decisions that align with their wishes,
Right.
even if those decisions might differ from what we would choose for ourselves.
Yeah. The textbook also discusses the importance of advocating for older adults
It does.
and protecting them from elder abuse and neglect.
Yeah,
That's a heavy but necessary topic.
absolutely. We have a responsibility to ensure that our patients are safe
Right.
and that their basic needs are being met.
Yeah.
If we suspect that an older adult is being mistreated,
Yeah.
we have a legal and ethical obligation to report it to the appropriate authorities.
A tough situation,
It is.
but you have to do the right thing.
We can't turn a blind eye to these situations.
All of these ethical considerations really underscore the importance of treating older adults with compassion, empathy, and respect.
Couldn't agree more.
Yeah.
It's about recognizing their inherent worth and dignity and ensuring they receive the care and support they deserve.
Absolutely.
They've contributed so much to our society,
Yeah.
and it's our turn to care for them.
Well, I think that brings us to the end of part 2 of our deep dive into geriatrics and polypharmacy.
Okay.
We've covered a lot of ground,
Yeah.
but we're not done yet.
No, we're not.
In the next and final part,
Yes.
we'll wrap up our discussion,
Yep.
focusing on the challenges and rewards of caring for older adults
Sounds good.
and some key takeaways for our listeners.
I'm looking forward to it.
Stay tuned.
Okay.
There's still much more to explore in the fascinating world of geriatric care. Welcome back to the final part of our deep dive into the world of geriatrics and polypharmacy.
Yeah.
We've covered a lot of ground, from those subtle signs of distress to the ethical aspects of caring for older adults.
It's been quite a journey. I hope our listeners are starting to see just how multifaceted geriatric care really is.
I think so. We've talked a lot about the challenges, but I want to shift gears for a moment.
Yeah.
What are the rewards? What makes this field so fulfilling?
That's a question that gets to the heart of why I do what I do.
Yeah.
For me, it's the privilege of working with a population that's often underestimated.
Mm.
Older adults have a lifetime of experiences and wisdom to share, and their resilience is truly inspiring.
I love that. It's not just about treating their medical conditions. It's about honoring their lives and recognizing the value they bring.
Exactly. And there's a deep satisfaction that comes from helping them maintain their independence and quality of life.
Yeah.
Sometimes it's a small victory, like helping someone manage their medications so they can stay in their own home.
Right.
But those small victories can have such a huge impact.
It's about empowering them to live their best lives, even as they face the challenges of aging and illness.
Absolutely. And let's not forget the humor. Older adults often have this incredible wit and perspective on life. It's refreshing and often hilarious.
That's so true. They've seen it all and they don't hold back.
Exactly. So, yes, geriatric care can be challenging, but it's also incredibly rewarding. It's a field that demands a unique blend of medical expertise, compassion, and a good sense of humor.
So as we wrap up, what are the key takeaways for our listeners? What do we want them to walk away with today?
First and foremost, I hope they've gained a deeper appreciation for the complexities of geriatric care. It's not just medicine as usual. It requires a different approach, one that recognizes the interconnectedness of physical, mental, and social factors.
It's about seeing the whole person, not just their age or their medical chart.
Exactly. And I hope they also have a better understanding of polypharmacy and the risks it poses to older adults. It's a serious issue, but it's one that we can address with careful medication management.
What can our listeners do if they're concerned about an older adult in their life who is taking multiple medications?
The best thing they can do is encourage that person to talk to their healthcare provider. Suggest they schedule a medication review to make sure all those medications are truly necessary and that they're being taken safely.
It's never too late to start that conversation.
Absolutely. Even if they've been taking multiple medications for years, a medication review can still be incredibly beneficial.
We've talked about the complexities of geriatric care, the dangers of polypharmacy, and the importance of a holistic approach to treatment. But I think there's one more crucial takeaway: the power of empathy.
That's a great point. Empathy is at the heart of good geriatric care. It's about putting yourself in their shoes, understanding their challenges, and treating them with the respect and dignity they deserve.
It's about recognizing that aging is a natural part of life and that older adults have so much to offer.
And it's about approaching geriatric care with a sense of curiosity and a willingness to learn from our patients. They have so much to teach us.
Here's a final thought-provoking question for our listeners. How would you want to be treated as you age? What kind of care would you hope for?
It's a question we should all ask ourselves. And I hope this deep dive has equipped our listeners with the knowledge and tools they need to advocate for themselves and their loved ones as they navigate the journey of aging.
Thanks for joining us on this exploration of the world of geriatric care. It's a field that's full of challenges, but the rewards are immeasurable. Until next time, keep diving deep.